Hey everyone, it's Anna here and I'm going to teach you descriptive studies today. It's my first video, so please bear with the lack of video quality and sound quality. I hope you enjoy the video. Please like and subscribe if you do. So what is epidemiology? Epidemiology is the study of determinants and distribution of health-related states or events in specified populations and the application of it to control health problems. So it's concerned with disease frequency, disease distribution, and disease determinants. A descriptive study is the first stage of an epidemiological survey. So the objective of it is to describe the occurrence of the disease with respect to time, place, and person. That's exactly why it's called a descriptive study. Now, the disease in a descriptive study is relatively new. Example, why would you want to do a study on TB when you already know its incidence and prevalence? You would actually prefer doing a study on SARS because you don't know its incidence and prevalence. And usually, study is done on available data. For example, patients are already presenting with cases or there are already records of patients in the hospital. So now if you're from Karnataka and you're writing RGHS examinations, one of the most important questions is the steps in a descriptive study. So we'll start with defining the population under study. What do we do when we define a population? So there's a large population, which I call the representative population, and a smaller population out of that population for which the study is being done. So now the representative population is the population for whom the study is being done. For example, you want to study the incidence and prevalence of anemia. You would like to do the study on all anemic patients that you see that are present, but you can't. So you choose a population, a smaller population, so that you can study the relationship, the cause of anemia. So the population for which the study is being done, it could be the whole population, it should be large, or it could be the representative population, and it should be large so that the results always remain constant. So there shouldn't be large migration or large immigration into the population. It should be large and should be relatively constant. This defining the population is a critical step because all the denominators for all the indices that you're going to calculate, such as indices, such as incidence, prevalence, all of it depends on the population under study. So now you're going to describe the population and define it under age, sex, occupation, literacy. For example, I would take a population under study as all women aged from 20 to 25 who are working in a tailor or handicrafts factory. The second step is define the disease under study. So now there are two ways you can define a disease. We all know there's a clinical definition and an operational definition. Now the clinical definition is not constant. It varies with every clinician, and if the diagnosis is wrong, the clinical definition can be revised. For example, tonsillitis is inflammation due to infection by strep of the tonsils. Whereas an operational definition is what the epidemiologist uses. It has a set of symptoms or criteria, and all the criteria must be adhered to. And an epidemiologist can choose his criteria based on the objectives of his study. For example, tonsillitis, he defines tonsillitis as red and large painful tonsils with cultures showing strep pyogenes. So that's defining the study. So till now, we have defined the population under study and we have defined the disease under study. Then we'll describe the disease. The disease has to be described with three variables: time, place, and person. Just a second. Yeah, focus. Come on, focus. Okay, so it's focus. Yeah, it's focus. Actually I can focus a little more. I'm sorry for the time. Okay, cool. So, described under its occurrence, you can have time variation, you can have geographical variation, and you can have person variation. Time variation, we divide the study according to its occurrence under three headings: short-term fluctuation, periodic fluctuation, and long-term fluctuation. So if the occurrence of a disease changes in days or hours or weeks, we'll say it's short-term fluctuation. And a very clear-cut example of this is an epidemic. Suppose a disease changes according to seasons or years and keeps repeating after a few years, then we can say it has a cyclical variation. And then the last type of variation is a long-term variation, where the disease generally shows increase or decrease in occurrence after a long period of time. So now an epidemic, let's talk about short-term fluctuations, we'll talk about epidemics. An occurrence of cases of illness or health-related states in a region or community in excess of normal expectancy. So you should remember it's in excess of normal expectancy, so you should already know what the normal expectancy of the disease is in the particular area. It's divided into three: common source epidemics, propagated epidemics, and slow epidemics. An epidemic curve is a graph of the time distribution of epidemic cases. So common source epidemics are further divided into two. They're divided into point source epidemics and continuous source. So imagine you suddenly get a sudden rush of cases of food poisoning and all of the people complain that they had eaten the biryani at a wedding. So you know the source of this food poisoning is a single source, which is the biryani at the wedding. This is what is called a point source epidemic. Another example of this was the Bhopal gas tragedy, where there was a sudden release of harmful gases that destroyed a whole community by itself. So now let's look at the characteristics in the epidemic curve of a point source epidemic. There is a sudden increase in the number of cases and there's a sudden decrease in the number of cases. You can actually compare this graph. What I do is compare it with a volcano. It's very explosive in nature, like all the cases are all of a sudden, and it's very steep. I mean, you know, when you think of a volcano, you always think of how it's so scary and it's just going to like blast anytime. That's how it is. Also, there's something called the median incubation period. This is the period where 50% of the cases are already have the disease. This actually should be somewhere here. I made a mistake. I'm sorry. This is 100% of the cases. This is what represents 50% of the cases. Next, we have a continuous source. Example: John Snow's water pipe that kept supplying water and people kept getting cholera. Over here you see a sudden sharp peak in incidence and a slow gradual decrease in incidence of the disease. You should remember here that all the cases start with this small incubation period, which is constant for all cases. But here, as more and more people consume the water, more and more cases start to occur. Let's go to propagated epidemic next. A propagated epidemic is almost always related to infectious diseases, where there's person-to-person transmission, there's a vector present, or there's an animal reservoir. So what you'll see is a slow rise in the disease as people start to propagate the disease to one another, and a slow decrease in the disease. You should also remember that how the disease decreases is related to the herd immunity present in the community as such. So you should see how one person starts transmitting the disease to two other people, and these two people start transmitting the disease to 6 other people, and it keeps going on like that. It'll only end when a person dies or a person stops being infected because he's being treated. Slow epidemics, or it can also end when there's a vaccination and it doesn't get transmitted more than that. Slow epidemics or modern epidemics are usually non-communicable diseases like diabetes and heart, atherosclerosis as such, where the incidence is really slow and it gradually tapers off. Next, let's study about the geographical variation. There's international geographical variation. For example, in India, oral cancers and cervical cancers are more prominent. There's national variation. For example, goiter is more prominent in hilly areas where there's lack of iodine. There's rural and urban variation. For example, TB is more common in rural places than urban places. And there's local variation. For example, the spot map created by John Snow, which I'm sure all of you know. A spot map is a geographical distribution of the place, geographical demonstration, of the place distribution of a disease of occurrence. So, suppose this is Bangalore, and a lot of people here start to have food poisoning. So, this place is getting clustered with all the cases. So, you'll probably think that the cause of food poisoning lies somewhere in this region. That's why spot maps are important, because clustering relates to the cause. Next, also in geographical variation, we can study something called migration studies. Migration studies are where we compare people who are migrated and living in another country with the environment that they were living in originally, and how that is affecting them to get a disease. Or we can compare people migrated with the new environment that they are living in, and how that is affecting them to get a disease or not get a disease. So, as I said, we can do that in two ways: comparing with relatives in their own country. For example, if you migrate to America, you could compare the incidence of sore throat of you in America compared to your brother in India, and comparing with citizens in the new country. So since you have gone to America, you could compare you having sore throat with other Americans of the same age, the same sex, having sore throat. Then there's person distribution, which is distribution of disease according to age, sex, socioeconomic status, and behavior. So age is actually a very prominent factor. For example, lymphomas are most common in younger age and oldest age. So as I said before, leukemias and lymphomas have a bimodal distribution. They're common in youngest age and common in oldest age. The next step is measuring the load of the disease. Let's just revise all the steps that we have done till now. What we have done is define the population. We have defined the disease. We have described the disease with variation of time, geography, that's place, and person. And now we're going to measure the load of the disease. So measuring the load of the disease can be done by cross-sectional studies, also called prevalence studies or longitudinal studies. Cross-sectional studies are when you just suddenly take how many people have the case at that particular point of time. That's why it's also called a camera click study. So at one time there might be 40 people having TB in your hospital. So at that time the prevalence of the disease is 40. This study requires decreased amount of money and decreased amount of time. The next type of study is a longitudinal study, where in a period of 1 year you keep taking clicks, almost like a video camera kind of thing. So suppose in January there are 40 cases, in February there were 60 cases. So this helps you find the incidence, because there are 20 new cases from January to February in the hospital, in your hospital, so you know the incidence of tuberculosis in your hospital. So this study takes increased amount of money and increased amount of time. The next step is comparing the indices that you've got with known indices. For example, if you've got the incidence and prevalence in your hospital of TB, you could compare it with the known incidence and prevalence last year. So you would know you would try to understand what changed to cause an increase or decrease in incidence and prevalence. You would then formulate a hypothesis, which is the last step of a descriptive study. I have made a mnemonic for the formulation of an hypothesis. I call it pop specs out to see reactions. Pop. You need to define the population in your hypothesis. Specs. You need to specify the specific cause of the disease. Out. You need to find the outcome of the disease, outcome of the cause. Reaction. You need to find the reaction of the cause and reaction of time after the cause has already come. That means you need to find out how much of the cause do you need to get a reaction and how much of time do you need when the cause is present to get a reaction. For example, you could formulate a hypothesis such as smoking, which is a specific cause, 10 cigarettes a day, which makes it more specific, causes lung cancer, which is the outcome, in a population of 40 to 50-year-old males in a period of 30 years. You know the dose is 10 cigarettes per day. So the uses, okay, that's it for now. Now the uses of a descriptive study. You can use it to find the magnitude of a disease, the cause of the disease. You can use it to improve health facilities available, and you can use it to describe variations in the disease, which is basically using it for research. And the types of descriptive studies are correlational or ecological study, case report, longitudinal study, and okay, wait, I can't read what I've written. Okay, I don't know what this is. Okay, coordination study, case report, longitudinal study, and cross-sectional study. Oh, this is a case series. Sorry. And correlation study is basically how you're studying various populations and how disease patterns are in the populations. It's also called an ecological study. Yeah, so I'm really sorry for the mistakes and going back after explaining something. I hope you will forgive me, and I hope you enjoyed the video. Please like and subscribe. I promise that I will make more videos with better improvements. Thank you.